Leg pain in diabetes. 15 easy methods to manage it. Welcome to a life-changing video that will help bid farewell to the agonizing leg pain experienced by diabetic patients. Let's shed light on the common factors contributing to leg pain in diabetic patients. Reduced blood flow. Diabetes can adversely affect blood vessels, impairing the flow of oxygen and vital nutrients to your legs. The compromised blood circulation deprives your muscles and tissues of essential nourishment, resulting in pain, cramping, and discomfort. Nerve damage. Peripheral neuropathy is a primary cause of leg pain in diabetic patients. The damaged nerves struggle to transmit signals properly, leading to abnormal sensations and pain. Inflammation. Diabetes triggers chronic inflammation, which further exacerbates leg pain. Inflammatory processes in the body can intensify the sensitivity of nerves and aggravate discomfort. The impact of reduced blood circulation. Inadequate blood flow amplifies the distressing symptoms of peripheral neuropathy. Without proper circulation, the muscles and tissues in your legs become more susceptible to damage and experience heightened pain. 15 methods to enhance blood circulation and manage leg pain. Method 1. Regular exercise. Engaging in physical activity improves blood circulation and manages leg pain in diabetic patients. Method 2. Compression therapy. Wearing compression stockings or socks enhances blood flow and reduces leg pain by preventing blood pooling and inflammation. Method 3. Healthy diet and hydration. Maintaining a balanced diet and staying hydrated promotes optimal blood circulation and manages leg pain. Method 4. Smoking cessation. Quitting smoking improves blood flow, reduces complications, and alleviates leg pain in diabetic patients. Method 5. Stress management. Practicing stress-reducing techniques relaxes blood vessels, reduces muscle tension, and enhances blood circulation to the legs. Method 6. Warm water soaks. Immersing feet and legs in warm water improves blood flow, relaxes muscles, and provides relief from leg pain. Method 7. Massage therapy. Regular massage sessions improve blood circulation, reduce muscle tension, and alleviate leg pain. Method 8. Elevation of legs. Elevating the legs above heart level helps enhance blood flow, reduce swelling, and relieve leg pain. Method 9. Medication management. Proper management of prescribed medications helps control symptoms, improve blood flow, and manage leg pain. Method 10. Regular checkups and foot care. Regular checkups and proper foot care help identify and address issues that may impact leg pain and blood circulation. Method 11. Acupuncture. Acupuncture stimulates specific points to improve blood circulation, alleviate leg pain, and promote overall well-being. Method 12. Yoga and stretching exercises. Practicing yoga and stretching exercises enhances blood flow, reduces muscle tension, and relieves leg pain. Method 13. Cold therapy. Applying cold therapy, such as ice packs, helps reduce inflammation, numb pain, and improve blood circulation in the legs. Method 14. Transcutaneous electrical nerve stimulation, TENS. TENS therapy uses low-voltage electrical currents to stimulate nerves, reduce pain, and enhance blood circulation. Method 15. Hydrotherapy. Water-based exercises and therapies, such as swimming or water aerobics, improve blood flow and relieve leg pain. We've explored 15 effective methods for enhancing blood circulation and managing leg pain in diabetic patients. Each of these methods plays a significant role in improving blood flow, reducing inflammation, relaxing muscles, and alleviating leg pain. However, it is essential to consult with healthcare professionals before trying any new methods or supplements to ensure they are appropriate for your specific condition. Stay motivated, stay positive, and never lose sight of your goal. Let's embark on this journey together and bid farewell to leg pain once and for all. You deserve a pain-free, active, and joyful life. Don't forget to like and subscribe.